session of today's awareness and education program. A morning session you have seen education on cancer imaging, and then now you are going to sensitize about drug delivery methods and awareness. So we have a very good speaker who is Dr. P. Vishwanath MS MCH surgical oncologist, present consultant surgeon for entire state of Andhra Pradesh, and he has real-time expertise and he has knowledge how to deal with cancer patients and how to give suggestions to deadly diseases on cancer. And then I request Dr. P. Vishwanath Garu, please come and give a few sensitization words on awareness of cancer. Please.
Good afternoon. Thank you for the invitation. Basically, cancer is now becoming one of the most deadly diseases affecting human beings. And according to World Health Organization statistics, by 2035, every 1 in 3 human beings are going to get contacted with cancer, and 1 in 4 are going to die of the disease. So unlike thought previously, cancer is no longer a rare disease. It's becoming more and more common, and it's also affecting younger individuals. It's no longer a disease of old age. So when we talk about cancer, basically we have more than 100 types of diseases which constitute a group of cancer, but the most common, about 10 types of cancers are most common, and we have different types of cancers common in different genders, males and females. In females in India, cervical cancer and the breast cancer are the most common. In males in India, the upper airway digestive tract and the lung cancers are the most common. Most of them, we don't know the etiology for cancer in most of the cases. We have some definitely risk factors which includes tobacco, alcohol, lack of exercise, obesity, stressful life, and pollution, environmental pollution, adult food adulteration. All these are the possible risk factors. So coming to the treatment, diagnosis usually is by very simple needle tests or biopsies, and once we have confirmed the diagnosis and staging, we have different modalities of treating. But surgery is the most mainstay of treatment for solid tumors. In fact, 60% of solid tumors are cured by surgery alone, and we have other modalities like chemotherapy and radiotherapy. In surgery also we have a lot of advancements, like previously we used to always do radical surgeries. Now we have come to conservative surgeries, where we are preserving not only getting an oncological outcome, but we're also preserving the function and the cosmesis. And we have a lot of advancements in the allied specialties, chemotherapy, medical oncology, radiotherapy, then plastic surgery, anesthesia, and also we are doing more complex surgeries with lesser morbidity and mortality. And we also are now doing surgeries by laparoscopy and oncology. Like any other disease, cancer also can be preventable to some extent, though not 100%. We have cervical cancer vaccines to prevent cervical cancer in young females. Then we have other preventable lifestyle changes. Now we are even doing surgeries to prevent cancers in patients who are genetically or familially positive. So what I want to convey is, unlike the previous days, cancer is no longer a dreaded disease. By diagnosing cancer, we are not writing an obituary note. Definitely, if we can detect it in early stage, we can get very high cure rates as high as 90%. And to prevent cancer, what's required from our staff is mostly lifestyle changes and lifestyle modification. Thank you.
An eminent professor from Andhra University, Professor D.L. Sastry Garu. We would like to listen a feedback from him about these sessions which we organized today. Please come, sir.
So, thank you, Dr. Ramachandra Rao Garu. I am a retired professor of physics from Andhra University, and in connection with today being the World Cancer Day, I took the opportunity to attend today's seminar on cancer imaging and drug delivery, organized at the Department of Physics of Government Arts College, Rajahmundry, by Dr. K. Ramachandra Rao Garu and his colleagues. And I am very happy that I attended this lecture, because I listened to very highly enlightening lectures by 3 people. The first lecture is from Dr. Nimmagadda Sridhar from Johns Hopkins University in USA. He spoke about the state-of-the-art technologies that are being developed in the detection as well as the cure of cancer Especially he talked about targeted drug delivery, which actually these drugs treat only the cancer cells and leave other healthy cells which are surrounding the cancer. And then we also listened to a very highly enlightening lecture by Dr. K. Ramchandra Rao Garu regarding use of radioisotopes in cancer treatment. He spoke about various radiation therapies that are available for cancer treatment. And in the afternoon session, we listened to a very reassuring or rather courage development lecture by Dr. P. Viswanath Garu, and he spoke about different surgical methods that are available for cancer cure, and he assured most of the students as well as the audience that are present there that the cancer is no more an incurable disease. It is a very much a curable disease now if detected early, and the latest surgical developments are very highly effective in curing cancer. And he has given a very inspiring lecture creating awareness among the audience regarding cancer, its early detection and what are the precautions that they have to take. And I think everybody who has attended today's seminar has immensely benefited by listening to these highly enlightening lectures. Thank you very much.
Thank you, sir. On behalf of the Department of Physics, Chemistry, Botany, Zoology, we extended our heartfelt wishes to the speakers, Dr. Nimmagadda Sridhar and Dr. P. Viswanath Garu, and then Professor D.L. Sastry Garu from Andhra University, and my colleagues and students. So definitely I hope you can get back a lot of message of this cancer and its awareness. So really it is an awesome program. If you look at the statistics, you know, in India nearly 7 lakh people are going to die every year about this because of this cancer. And as per World Health Organization statistics, the oncologist, very few oncologists available. So the now ratio is 1:2000, and now the government target is at least by 2025 we need to get at least 1:1000. So that means on this World Cancer Day, the Department of Physics and Chemistry, Botany, Zoology came forward and arranged an excellent lecture about awareness and education about on cancer. And I really overwhelmed about the lectures who delivered on this great platform. On behalf of the Department of Physics and Government College Autonomous, once again heartfelt thanks to each and everyone who participated in this program. Thank you one and all. Thank you.